Assalamu alaikum and very good afternoon. I would like to welcome you all to the special Back to School webinar with Prime Health. And thank you for joining us today. I'm Dr. Asia, Assistant Medical Director and General Practitioner at Prime Health. We are live from our official social media platforms, including Instagram, YouTube, Facebook, Twitter, and of course, LinkedIn. It is common for parents and kids to worry about sickness and health during back to school season. For many families, back to school also signals the end of summer lazy days. We speed up to keep our kids healthy, update their immunization schedules, and re-establish more structured eating, television, and bedtime routines to help you all prepare for a healthy school year ahead. We have invited two specialists on this webinar today. They'll answer your question and will share relevant information with us. So all the parents, teachers, kids itself, if you have any question for us today, feel free to write in the comment box. So let's begin with our first. I would like to invite my first speaker on this webinar is Dr. Vinay Vyas, who is a pediatrician and a member of Royal College of Pediatrics and Child Health. We are glad to welcome Dr. from Prime Medical Center, Al Nahda, Sharjah, to join us today. Welcome, Doctor.
Thank you so much. We're glad to be part of this webinar. Thank you so much.
Thank you. Dr. Vinay has more than 16 years of clinical experience and is a highly qualified physician. Bringing back the smile of younger children and their parent is his main objective. Dr. Vinay Vyas is compassionate, kind, and caring towards his patient. Thank you, Doctor. I would like to introduce my second speaker on this webinar today, Dr. Nehla Sobi. Her specialty is pediatrics, having earned her master's degree in pediatrics from Egypt. She has also worked as a pediatric oncologist and general pediatrician in Egypt and Saudi Arabia for more than 15 years. Before joining UAE Healthcare, Dr. Nehla is always focused on relieving the child physical or mental stress. Her belief is that both factors affect the child's stability and future as well. Her strong belief is that children's smile and optimistic look are the future of our world. Dr. Nehla has joined us from Prime Medical Center, Mizhar branch. Welcome, Dr. Nehla. So I'll begin my session with asking first question. Whenever we do any kind of webinar, we have a lot of questions from parents itself. So the most popular question among parents, Dr. Vinay, is what is a routine health check-up recommended for a children as schools are reopening?
Yeah, surely. The routine health check is very much necessary because here schools, mostly we are expatriates and we come from different places all over, from like India, Pakistan, Philippines. So we have got a different background exposure, different culture also, and most of them after school break, they have traveled and they are returning. So a routine health checkup is at least a week before starting school should be recommended. That helps us to establish that there has been no sign of infection, illness, whether they are fit enough to attend school, which is now being like shortened 4 days in Sharjah and 5 days in Dubai. So they are it's quite tiring and they stay quite long, whether they are fit enough to be there, they have got fair energy. Routine checkup will definitely start from head to toe, hair, eyes, dental checkup, overall health. So I strongly recommend for all the parents that they take their child to, if they have any complaint, that is fair enough. If they don't have any complaint, still take a routine checkup to the doctor, to your pediatrician, and better get them assessed and make them fit both mentally and physically to go to school healthy and happy.
So, Doctor, when we talk about, I'll continue my question. When we talk about healthy checkups, the social media is flooded with healthy checkup parameters. But what is basic thing what parents need to know that at least this much is important, what they can expect from pediatrician to do for their child? Is it necessary that we have to go for blood test or any kind of x-rays, or it's important to meet the pediatrician itself?
Well, it's important to meet the pediatrician rather than doing the checkup or the tests and the X-rays. Just go and routinely see if it's required for them to have a blood test or an X-ray. Yeah, definitely it would be recommended. But then most of the time, routine health checkup is just seeing the child, knowing any problems he's facing, nutritional wise, or any other anxiety or those related disorders are means illness is there. So just allay the anxiety of parents also and children also, because they're old enough they are, so they may communicate themselves. So it's not going through the invasive tests and X-rays or investigation. It's a routine checkup, and it starts
Thank
from
you.
head to toe, as I said.
Absolutely, doctor. It's very important for all the parents to know that meeting is more important than choosing any health package, because it's a matter of kids, and it changes than the adult wellness packages or adult annual health, what we generally recommend. So meet your pediatricians if you're having any concerns. So my next question to Dr. Sobi is, since it's a long holidays, it was a long holiday season, and suddenly it's too much anxiety among kids. How to decrease child anxiety about starting school?
Okay. So they spend about 2 months enjoying their time, maybe regardless any rules or any instructions. They know that the time in their hands, so they can enjoy whatever they want. The main issue usually in their mind that they will be under strict control when they go back to school. They will be limited with time to sleep early, to eat that, to do that, to do your task in the school. So mainly the anxiety will start when they feel the strict discipline, which is going to be starting. So if we started to clarify to them, this is discipline will help them. It will be like a fun to start your day early. We will talk to them straightforward and very clear. That is help to your future, like to be clear when explaining anything to the kids, they will be happy and they will respect the instructions actually. And we can prepare for the school with the fun, like preparing clothes, preparing lunch boxes, preparation for the activities also during school time. That will release the anxiety, will improve it.
Thank you, doctor, for that. Now, I would like to ask Dr. Vinay, important thing, since we all understood the importance of vaccination other than the routine one, how to make children realize the importance of immunization. What I mean to say is that now, earlier it was a scheduled one, which we have to go 5 years, 10 years adult vaccination. How to make them a part of it and make them realize, rather than fear, that this is, how to make this concept very clear for this immunization? How will you recommend?
Yeah, definitely. What we have seen in our day-to-day practice, that parents are very cautious and concerned about the initial vaccination, which happens after birth, and then till 6 months ahead, and then till 18 months. But after that, most of the parents, they lack vaccination. They tend to forget because there comes a gap of vaccination. So what we have observed, and now everybody knows the importance of vaccination and immunization, because we were going through this pandemic, and everybody was vaccinated. So they know the importance of vaccination, how it works. Even a child, we ask them if vaccination is important. They know, most of them, the older ones, and they are very much aware of it. So what we do is we emphasize every visit, and even a routine health checkup, we emphasize that we see their vaccination card, we go through it, and we recommend whichever is required. And definitely during the season, when it comes like this season, we are expecting winter now. So there are some vaccination, like a flu vaccination, which is often encouraged. and advice to parents so that they become safe. And we tell them that what can be the benefits of the vaccination and how we can go ahead, and routinely we should ask if they have siblings, they are also advised and offered to go through vaccination those and complete their immunization schedule at least before attending the school and getting exposed to the other kids who may have infection with them. So yeah, we have got a protocol also to send them reminder, since they are our associates. So we send them reminder, and we let them know that they are scheduled for vaccination, and they definitely respond. And we are kind of getting good response of that.
Doctor, since you say that reminders, do you still feel that parents need to remind about the routine vaccinations?
Yes, sure. As I said that after 18 months of age, there is a gap of vaccination. So they often tend to forget and get confused also sometimes that which vaccination is due and when should and where should we get. So we often encourage them, and then reminder is also set. They are always informed and they should be updated about their child's vaccination. Yes.
Absolutely. I believe at Prime Health, we believe in reminding our patients on time so that they don't miss the important visits. Dr. Sobi, continuation of the same immunization, what is the recommendation of flu vaccines for children?
Recommendation regarding the age of flu vaccines, we can give the flu vaccines more than 2 years of age safely for all our children as well as the current vaccine, and we should start it during the season of flu, which is starting from September every year until the month of March. And the precaution, usually we should make like a regular checkup routine, medical checkup before starting the vaccine. As if they have flu, we should not give the vaccine. If they have fever or high grade fever or any other illness, we should give some time for the body to rest. After that, we'll be ready to receive the vaccine.
Right, doctor. Doctor, I have one question from my mother. She's really concerned that what is the best way to help any child prevent picking up disease at school? Since many school children are coming from different countries, and initial first 10 days we have exams also scheduled, and it's like travel from many of the countries, so infection could be probably high. So how to relieve these anxious mothers, and how to reply to their questions?
First, we should know that the infection spreading in between kids, among kids in the school, either a bacterial or viral infection. So sources of infection usually it's coming from water, air, food, or sometimes the vectors like insects or any vectors available. So the principal mode of transmission also is a contact, airborne or droplet infection. So we should follow the rules to prevent exposure to these factors. So we can start first by up-to-date vaccination, like we give the vaccination in the start of school year, especially when we start the vaccine, flu vaccine. Second, to go for the health hygiene, we start with the hand washing. We should teach the kids how to take care of their hand hygiene, their personal hygiene also, to make spacing, to avoid the crowdness, and to avoid the close contact with their classmates. And we can go also to the school instructions, like they should stop the share of food between kids, stop the sharing, stop the close blending with kids also, sneezing and coughing policy, as they should they should avoid to expose others to their droplets. We should go for the sources of the school, like water should be clean, water fountains should be prevented actually in the times of outbreaks, to make sure that fresh food is there every day, take plenty of water, much amounts of water every day to help their body to be well hydrated all the time. If there is any symptoms of illness starting to show, we should evaluate the child. Don't send him when he's not feeling well, as that may be starting on some kind of infection, and it will be becoming worse if he's making effort and exerting effort in the school, and he will infect others also. So we should start by the steps one by one.
Thank you, Dr. Sobi. I think that was very informative. All parents, I'm sure they're taking care of that, but still, our children can become ill. So, Dr. Vinay, question to you is, when to say child is not well, and suppose he's going for exam and suddenly in the morning mother is realizing that child is lazy, and what should be done by the parents at that time?
Yes, often I have seen parents sending their children school when they are sick. Yes, yeah, that is a good question. What happens that when in the morning, as you said, that if you find that child is running fever or running temperature and have is not healthy enough to visit school or go to school, lazy being a sign of illness also. So if he's lazy, he or she is lazy or dull or is showing temperature, yeah, definitely contact the teacher or school and let them know that he's not healthy enough to visit school, and try to stop him, not to send him school and not to make him sick further or others also to acquire infection from him if he is running. The other vital thing I would like to comment is that parents should know that importance of sleep. So their children should sleep very well, and it should be at least minimum sleep has to be taken care of to find their child fully and awake in the morning. So that is another thing which is very important.
So, my question, doctor, what parents should do at that point of time? Should they send them to school, or they should go and book the teleconsultation, or probably taking care of them at home? If specifically, if it's an examination timing.
Yeah, exam day also, if they are lazy, dull, or sick, not to send them to school. Write a note or letter to the teacher. If you feel that child is running temperature or is quite sick, then take to the nearest clinic or hospital and visit a pediatrician and show them, so that they can be treated fast. And since examination must be going in continuation, so they are supposed to get well as soon as possible and fit enough to go and perform their tests or exams.
So all the parents, please be very clear. If your child is showing any kind of symptoms, for example, lazy or having fever, please don't send them to schools. I'm sure we all have pediatricians, one or the other we connected to us. Please feel free to speak to them. Book teleconsultation if you cannot go, but speak to the pediatrician for the appropriate advice. Now, I would like to continue, Dr. Sobi. Dr. Sobi, when do we say it's a fever? What is the definition of a fever actually for parents to know? How to check it, and what is the range of fever they should be really considered?
Okay. Usually we depend on the regular way to check temperature. It is from the armpit axillary temperature checking, which is coming like half degree below the normal body temperature, the core body temperature. Usually if they check it from the armpit and it's coming like 37, that means it's 37.5. Okay, how to tell about the temperature my child has fever or not? If it's coming to 38 degree once or more than 37.6 for long time, like more than 1 or 2 hours, we should observe the child. And if his fever rising more than 38, that be considered as fever, as temperature.
Okay, so doctor, so for parents, it's important to know, even if they are checking the temperature from armpit, they have to add one more point, to it, and they should consider it fever and should take the appropriate opinions or advice. Doctor, I want to know, since we talked about with Dr. Vinay about, a kid is not well and not going to school. Suppose a kid is well, but his brother or sister is not well and is having high grade fever. Should we still send the other kid to the school if symptomatically they are fine?
Okay. Once the child is having no symptoms, not showing any symptoms, and he's having like a proper and good hand hygiene, we can send him to the school. But some daycares and some other places, some schools, they have the policy like if your brother or sister is sick, don't come to school. Or if anyone sibling at home is sick, don't send to school. We should respect their policy. But actually, if they have no symptoms and they have good hand hygiene, we can send to school. Something else, some daycares and some places prevent sending to school if anyone at home has some kind of infection, gastrointestinal infection, especially with vomiting and diarrhea. It's highly infectious, so we should respect the policies also.
Thank you, Doctor. Dr. Vinay, now people are coming back from vacations. What is the concern of parents you see generally in OPD these days?
Yes, parents coming back from vacation, they are traveling. So most of the parents come with kids having vomiting and diarrhea. So this is the most common mishap which is happening because of travel. Apart from that, there is a change in environment. They are coming from a hot place or cold place and rainy areas, and they also face respiratory ailments. But most of them is of stomach problems like vomiting, loose motion, stomach pain. We had encountered quite a few of patients in recent past.
Thank you, doctor. And in general, any suggestion or advice for the parents? What to do, not to go with the homemade remedies, and when it is really serious for them to visit a pediatrician?
As I said, there are two more most important aspects which often parents neglect. They know that, okay, this has to be done, medicine, which one has to be given when fever is there. But they often forget hydration. Hydration of a child is very important in both the ailments. Even for vomiting, diarrhea, obviously you are losing water. You have to replenish your deficits. But in cold cough also you require a good hydration so that you can have a good amount of immunity, and also you can fight against infection properly. So hydration is very important, which is often neglected. The other aspect, as I said before, sleep. We find because of the holidays, they have got a different sleep schedule. They don't sleep well in the night, or they sleep late and then they wake up late also. But now it has to be changed because schools have started. So they should sleep early and then they have to wake up early also. So proper sleep is very important. These two aspects are definitely ignored. Visiting a doctor, yeah, definitely for routine. Otherwise, if there is a persistent vomiting, not stopping, or persistent diarrhea, definitely fever is also recommended to visit doctor, because it's not usually we don't ask first day to visit doctor if fever is there. Or, but in this case, because they have traveled, they may have got some infection from back home. So that is important that they visit their pediatrician or just have a word with them, and they can later on take a consultation and treat them as soon as possible.
So, doctor, what do you find the most common reason? For example, 10 kids with parents have visited you. What is the most common important reason? Same reason you are finding in every kid having a loose motion and diarrhea or vomiting?
Most of them, since there is a lack of hygienic food, or their hand hygiene has been compromised. The kids, they keep touching everything, so they may have contaminated themselves. Contaminated food, that, as I said, water, it's very common. So we find because they are traveling, they may have come from some remote place also. So we often find them being suffering from this illness.
And generally, this once they are diagnosed with acute infection, and obviously they'll not go to school, how long it will take them to recover from this?
Usually, if it is a common illness, they recover within 1 or 2 days. They don't take much time to recover. They get sick very fast, children, but then we find them to come up nice in a few days. So, yeah, if they are taken care of in a better way and given proper medicines which are required, they definitely come up in a couple of days and they are fit to go to school.
Thank you, Dr. Vinay. Dr. Sobi, I have a question about child's performance at school. Do you often see such concerns from parents, how child is behaving or their performance in school, how to make it better. What is the pediatrician's role when these complaints or comments from parents comes to you? How do you deal with it?
Yeah, recently it is highly recommended by the American Academy of Pediatrics even as the pediatrician should be involved in the well-being of the child and academic learning also in the school, as the screening test and regular checkup for the child will help to get and find out the potential risks for the any coming disease or any starting illness. Sometimes they have the concern of the lack of concentration, which is coming usually with some low marks in the school, and they start to search and check what is behind. So after that, they visit the pediatrician. When the screening tests are done, sometimes we discover the iron deficiency anemia, some malnutrition in the form of vitamin deficiency also. So we start treating and correcting early, which helps the problem to be find out early, and we correct it early to be treated.
So, doctor, what is the what do you suggest actually to parents how to keep their children health and well-being in control? How to take care of their physical as well as mental health?
Physical, starting with the routine, as you mentioned, doctor, in the start of our talk, starting the healthy lifestyle is a cornerstone. To sleep early and to have a good amount of sleep and to get the healthy lifestyle, including sport practice and taking healthy, nutritious food with all the important ingredient in their diet. To avoid the junk foods, which is wasting of health and wasting of time for money also most of the time. So to concentrate of the helpful ideas during the daytime, like playing sports, reduce the time of screen times for kids also, which is making a big problem nowadays, including obesity and constipation. Starting from a long screen time to help the health lifestyle is a starting step. After that, if they observe any abnormality in the school performance and the daily activity of their kids, they should visit the nearest doctor or clinic to evaluate. Maybe something is hidden and the potential risk and they didn't discover. Doctor will help them to discover.
Great, doctor. So I just want to understand. So pediatric age group is generally from birth. To see the teens having more concern on the food part rather than the younger, more younger children, or how do you see the variation? Or teens don't visit pediatricians at all?
Sorry,
Do you see teens visiting you?
Yeah, I see teens visiting me. There is big difference in the concerns for each age group. Like the small kids are different in treating them, even in my clinic also. And teens, they have different mindset. Teens usually they want to feel everything from their own opinions. Usually I discuss with them, not with the parents. In front of parents, I discuss with them how to go for the healthy lifestyle, especially the gaming time. These issues nowadays very common and wasting their time, getting nervous, sometimes with headache, also some eye problems, the eye dryness also. I got many complaints because of the gaming screening times. So I start to advise the teenager, and usually I am clear with them, talking from the scientific point of view. And usually I mention the evidence-based information because they realize what you are telling and they will go and search also. So we should be very meticulous and very precise and talking to them.
Absolutely. Dr. Vinay, I would like to continue this question with you because obviously we have different nationalities coming. When teens are coming to you, obviously the biggest concern is the technology, classes also on, we have to use screen time a lot. If you can give little brief that what is the recommended screen time age-wise, that will be of great help. Also, what do you really suggest to all the kids, how to take care of their eyes and well-being?
Yeah, definitely. Nowadays, in this era we are facing is, and before when pandemic was there, most of the children, the students particularly, they were constantly subjected to the gadgets, the devices, and their screen time was remarkably, unfortunately, very long. So this now, fortunately, back to school, and the screen time has gone down for kids, and they are yeah, much more in a eye comfort zone now rather than before. The screen time for the teens and elder kids would be different than children who are less than 10 years. So, for less than 10 years, particularly, I would suggest that they should not exceed their screen time more than 1 hour per day. Other than their studies, which they have to do because there are some presentation or teachings in screen, so that they have to do. If they are bound to do, they have to do. Otherwise, not to exceed more than 1 hour per day. And that also they have to. They should formulate such the parents that it should not be a smaller screen. It should be a larger screen. They can now we can connect our television also with the phone or the device. So that would be in a much better way if they are connected to a television, and then the strain would be less. This is mostly less than 10 years, they have to be very careful. And particularly when you see your children gaming, that is one aspect which they have to be careful, parents, that children should not do excessive gaming and spoil their eyes, because their focus and attention is very much highly required. So I would not suggest more than 1 hour of screen time per day as a leisure. For teens, definitely, most of the studies, they have to do more studies than the younger children. They are subjected to screen time, so they are allowed as per their study schedule. They are allowed to see, but then it should not be a continuous watch of device. So, what we recommend in older kids is that they should, for example, study for 40 minutes or 50 minutes, take a break. Splash water in your eyes, give some rest. If they want a short nap, also try to take a short nap also. Not to see other screen, like go and watch TV or something else. Try to relax themselves and keep an ease on their eyes. So they are subjected to studies, fine. Otherwise, they are also not for leisure. They should not also exceed 2 hours per day.
So, doctor, do you see increased number of cases related to eye issues with children these days?
Very much, very much. We see a lot of children getting spectacles at young age. We see older children also having problem in their eyes, excessive rubbing, dryness, and sometimes infection also encountered. So definitely we see quite few cases, and then we have to refer some cases to the ophthalmologist to know that whether they are going well with their eye vision, or they require change in lenses, or they require spectacles at all.
So, Dr. Sobi, when is the concern for parents or kids about eye symptoms? Because we're talking about, back to school and screen, everything is on screen. So, this is really important to know that for the parents to know that the cases are rising, and what precautions actually they should take. The most important thing when they should start worrying about the kids' health and getting their eye checked, because for kids we generally don't have, I believe, the recommendation 6 monthly or yearly. So I want to know from you, for the parents directly, that when is the concern they should visit the pediatrician or the ophthalmologist to get the eyes checked?
First of all, we should respect the complaint of the child. Like if he's complaining of headache, chronic headache, or recurrent attacks of headache, we should consider it. We should consider also the blurry vision. If he's complaining of blurry vision or double vision, this is very important complaint we should take into our consideration. Headache may be caused by some eye problems, and or other than that, maybe some sinusitis, some cold and cough also may cause headache. Fever may cause the headache. Teeth problem may cause the headache. But we should ask them our details and take them to the pediatrician to start the evaluation. According to pediatrician evaluation, he will try to go to find out what's behind the headache and rule out other causes. If he directs them to ophthalmologist, we should go direct because it's a serious issue. Something else is the dryness of eye, the predisposing factor for eye infection. So if they have the dryness, they will suffer from headache and the infection also. So nowadays, they should use like refreshing eye drops as routine when using screens. This is highly recommended because it became routine use of screens. So it should be routine use of refreshing eye drops also for hydration of the.
And I believe we should speak to the schools also to make eye checkup mandatory. I think we should take a lead. I mean, specifically when because all the kids are coming to pediatricians, I believe we should think about it so that we can prevent the eye issues in the children. As you correctly said, that they're the future of the country, so we have to take care of them at very early stage. To Dr. Sobi, I want to ask from you, a lot of because this is summer, there are parents concerned about the water intake of the child. What is the normal water intake for 5 year or 10 year, and how to get the child really take that much of water? It is struggling for mothers.
To improve the water intake of child, it is something very important, a serious issue also in their life. As the water play an important and big great role in their immune system. Amount of water is variable according each child and the surface area of the child and weight. So they should not be less than 1 liter per day, but variable according to the weight and the surface area, as we said. We should encourage them to take water as much as we can, plus fruits, which is full of minerals and trace elements like potassium, like other minerals, sodium, which should be in a correct amount in their body. Also, if the child has faced any kind of gastroenteritis with vomiting or loose motion, they will lose a lot of minerals and potassium, sodium, many elements will lose in the stool, which will lead to dehydration. So to correct the dehydration, it's very important to be from the start of the illness, not to wait until we get the mild to moderate degree of dehydration, and to make sure our kids are well hydrated all the time, taking proper amounts of water, proper amounts of fruits also. It's very important to protect them against many other kinds of infection which depend on the dehydration in their body.
And absolutely, mothers can also add watermelon and cucumber as they have highest amount of water in them. So, Dr. Vinay, I want to know this. A lot of mothers and actually parents, even kids complain of the leg pains, and then eventually everybody has this thing in their mind that kid is suffering from vitamin D. So, what is your perception that does every kid in UAE specifically, because we are mostly indoors and very less outdoors, are we all suffering from vitamin D as far as the kids is concerned? So your take on vitamin D in brief.
Yeah, vitamin D is a very important element which most of the children we face that they are having deficiency. So vitamin D being a very important part of their health because though we have enough of sunlight, but we are not exposed much to sunlight because it's quite harsh. So vitamin D deficiency is quite common. But as you asked that for leg pains, I don't consider vitamin D be the only or sole reason of having those pains. So apart from vitamin D deficiency, which is obviously important, and we should supplement vitamin D to children, particularly growing children, but then the leg pains have got their different reason. One, children being very active, they are always running here and there. The blood circulation whole day is very high. Evening or night when they sleep, there is sudden stop of circulation. So that gives important cramps. So that is one reason which I found to be in smaller children who are always on run. The other reason, as discussed previously, hydration would be very important. Parents should definitely take care of hydration of children so that there shouldn't be a lack of water intake or like sodium should not be less in the body so that cramps may come or leg pains may happen. Then comes vitamin D, which is essentially very less in children over here because of lack of exposure. So they may require supplement because not being exposed is one thing which is quite relevant in this aspect. Yeah.
Thank you, Doctor. I would like to ask some quick questions. What is the SPF factor we should use for kids? So a lot of questions have come. I'm just picking up some of them to answer.
Yeah.
By you.
SPF factor is it's a sun protection
Sunscreen.
factor.
Yeah.
So it's because the clouds cannot filter the UV rays from the sun, so it
Right.
often impacts on the children. It depends on the age and how much mature their skin is. For infants, we suggest that first of all, try to avoid the sun for them, not to be exposed much to the sun. If they at all are facing, they have to go outside or outdoor and then they face sun. Use some measure like put on cap or something so that it is less on them. If they have to use sunscreen, then they can use a sunscreen which is SPF 30, 50. So that would be a mild one on the face and on exposed areas. That won't hurt them much, and that will help them. Older children, it can exceed from SP 30, 50 or more. It depends how much they are exposed, and that is important that if their skin allows it, if it is a dry skin or it is a wet skin, if it is dry skin, they may require more. The other important part is because they are not there for an hour or two, they may be out for few hours, like 4-6 hours. So they have to repeat it after 2 hours so that the effect does not go down. So that is important. Yeah, again, I would consider having a good hydration is important here to make it affect more.
Thank you. Dr. Sobi, there is I'll call it a fashion statement. Everybody thinks that, weakness comes and we need to take multivitamin and we immediately go to any pharmacy and buy the vitamins. What is your suggestion for parents to know about before buying multivitamins of their own without consulting the doctor?
So, as we all know, multivitamins is a medicine, not a nutritional only. It's a medicine also. So, before starting any medicine to our child, we should evaluate either he needs this medicine or no, he needs the vitamin or no. Even vitamin D nowadays we give as a supplement, but sometimes we do the vitamin D test and they have the normal level, so adequate level is okay. So no need to give. At least we should visit the doctor and get the proper evaluation and the blood test for the vitamin serum level. We have all available in our hospitals nowadays, so it's not difficult at all. So we can get the proper evaluation. According to that, doctor will advise what's recommended, which vitamin, which iron, which element is deficient for my child, and how much I should correct or give the maintenance therapy of only. Like there is correction of the deficiency and sometimes maintenance. Sometimes we give the multivitamin after the illness, long time illness, or if he has some kind of nutritional problem, deficiency for long time. After that, we can help them to catch up by giving multivitamin plus the proper nutrition also.
Thank you, Doctor. Doctor, I would like to know, since we talk about, flu vaccination already, is this the right time we should proceed for flu vaccination since we are in September?
Yeah, definitely. This is a correct time to start because the start of schools, nowadays I have many patients, many well-oriented parents bringing their kids to the clinic to start and take the flu vaccination. So they will go to mix in the school. And whenever we have when we have the children fully vaccinated, we will reduce the chance to get the infection. So once we have one child not vaccinated, we will increase the chance for the infection to spread. So as much as we can vaccinate our children, we will protect others also from the infection.
So, Doctor, what is the current COVID vaccination recommendation for school-going kids?
Now it's valid to give the Pfizer vaccine nowadays. The recent one we are giving to school kids safely.
Okay. So, Dr. Vinay, I just want to know, Should children still receive the sunlight, vitamin D, or they should take supplements if they are symptomatic?
If they are symptomatic, definitely they have to get supplementation. As doctor said that they should be properly judged and tested before giving supplement, because whether it is a dose which is to be given, which dose to be given, that is important for them to know in a symptomatic child. Exposure to sunlight is also very important. Strongly recommend to expose their children to sunlight, but be careful that they don't do excessive of exposure, which may cause them sunburn. For that, there are so many creams being available, and it's possible to protect them. As should be some like their variables should be such that they should not be going through all this problems of sunburn. Yeah, definitely exposure of skin to the sunlight is important. Some times we advise parents to expose their skin maximum to the sun for them to get sunlight and have a natural vitamin D in that. Yes, sure.
Thank you, doctor. So, doctor, I have small, because we are proceeding towards end of the session. I have a small case scenario, wherein because you see a lot of kids having this cold and flu, and this looks like everyday things. Specifically, in when kids are in nursery, every child has a running nose and they are coughing. I have visited some of the nurseries previously also. So, and then still they are coming to the schools and there's no fever, but running nose and cough. What is the advice for nurseries or schools and parents to do at that point of time?
Yeah, it's like because the kids who have newly enrolled in nurseries, they don't have any sort of immunity or exposure to illnesses. Once they join nursery, they get all the cold and cough manifestation. That's very common. For nursery point of view, yes, they have to keep at least the standard protocol of keeping how many kids they can keep at a time, how much AC setting it should be, and how they should keep distancing and keep their hygiene nice. Particularly visiting toilet should be clean. So these are the basic protocol they should adapt nursery, and check the vaccination also if all the kids they have been vaccinated or not. As being parent, I often say that child would often have cold and cough. That should not deter them to send children to school if it is not affecting their lifestyle. If they are able to sleep well, eat well, play well, and a mild cold and cough would be acceptable. But it should not affect their lifestyle. If it's affecting their lifestyle, problem in sleeping, like coughing in the night, and also if there is fever, definitely they should not send their child to school. Some of the parents I educate in the beginning that don't send your children every day. If it is a 5 days a week, try to skip one day in between. Just get them into their immunity and then resend them, so that you'll be able to send them maximum. Otherwise, they'll get sick and they have to be absent from school. So often parents are doing that, and it is helping them a lot in giving their own break and gaining immunity. So that helps a lot.
Thank you, doctor. And now we'll proceed with the take-home message. And I'll start with you, Dr. Vinay. What is that message which you would like to tell everyone? Because I believe it's parents, it's mothers, it's kids itself, or organizations, schools who are listening to us or who will listen in the future. What is that important message for all of them to know from a pediatrician?
As a pediatrician point of view, I would suggest all the parents to send their children to school regularly, timely, make them eat well, drink water well, sleep well, try to keep their immunization schedule up to the date, try to make them mentally very much fit to go to school. always speak to them, always talk to them on your table, lunch table, dinner table, whenever you feel, you speak to them. Particularly the older children, they have got so many anxieties, and what is happening in their school. Ask them questions when they come back. Keep on taking sessions of them that they tell you everything about the school. On nutritional point of view, you should see that they are eating proper food, fruits and vegetables particularly, which is mostly ignored. They are eating well or not, they are deficient in them or not. uh, yeah, and also if any concern, please contact your pediatrician or visit your prime medical center nearby, so that you can be guided properly. Don't make your own decision on health. Don't give any medicine which is not used for your child, particularly the vitamins which are mostly given by parents to their children. So please visit pediatrician and ask any questions whichever is relevant to your child for their future and their health.
Thank you, Doctor. That was very valuable. Dr. Sobi, would like to hear from you, Doctor. What is your take-home message for all the parents and all the listeners who are with us today?
Same as the doctor said. Now we should keep the proper and healthy routine for our children. We should take care of the general health, and they should sleep early. They should eat well. Take care of the kind of food they are receiving, like nutritious food, not any kind of food. We should take care about their complaint also. Like we should take in our consideration any complaint from our child. Do not ignore if he is complaining, even from something we look at it as a light complaint. We should take care of it, consider it, talk with them deeply about what is happening around them in the world nowadays. We should know their opinions on everything. From this point, we can also advise them properly. They will listen to us, and they will take seriously our advices, and they will follow our instructions regarding their health, their mental health, physical health. If we advise for sport, for anything, they will consider it and they will follow our instructions also. Our children performance in the school and their attendance, their performance, their marks is a feedback to us about their mental health and their psychological issues.
Well-being.
Yeah, well-being also. So if we notice any reduce or any decline in their marks and behavior and the performance in the school, we should stop and try to check what is behind this. So any frustrating problems happened last year in the school, we should check it and search and find out what was behind it and dig deeper to get what's behind our kids' problem. And if we ask, we need the help of pediatrician or any other specialty of physicians, we should go. Don't hesitate to go, because if any issue is solved early, one by one, we will go to the best to find out what's behind and solve the problems early. No accumulation of any health problems or mental or physical or any psychological issues.
Dr. Sobi, I'll request you to say a few words in Arabic as well, because we have a lot of Arabic audience and would like to hear from you.
Okay, in Arabic now?
Yes, please. Thank you so much.
So, لابد أن نأخذ في الاعتبار أي شكوى للطفل أيا كانت، حتى لو كانت تظهر لنا لطيفة وبسيطة، لابد أن نعتبر بها ونبحث ما تسبب في هذه الشكوى، وأن نتابع الأبناء يعني في المدرسة والأداء الدراسي للأطفال، لأن يترتب على أدائهم الدراسي ما يعطينا خلفية عن ما يحدث بداخلهم، سواء كانت أشياء صحية عنده يوجد مشاكل صحية أو مشاكل في الاستيعاب تترتب على بعض الأمراض. لابد أن نبحث جيدا ما حدث للأبناء في العام السابق وما تسبب فيه، وقد نجد بعض الأشياء التي نحتاج لمساعدتهم فيها في تجاوزها، صم إعاقات، صم بعض الأشياء يعني لتجاوزها.
Thank you, Doctor. Thank you, Doctor. Thank you for that cover up. I would like to thank all my viewers for joining us today. It was a very interactive session, and I have learned a lot today from my speakers. As you know, at Prime, we believe personalized care personally. With this, in September, we're going to talk more about chronic diseases and specifically heart health. So if you have any suggestions or feedback, please feel free to write to us on the email myprime@primehealth.ae. And you can always, if you have any queries for our respected speakers, they are the pediatricians at Prime Medical Center, Al Nahda, Sharjah. Dr. Vinay Vyas, you can meet him or book appointment with him. And we have Dr. Nala Sobi at Prime Medical Center, Mizhar. This was a thorough, informative session. Thank you for joining us today. Stay healthy, stay blessed always.